Think your cat is safe from kidney disease because they're young, or they drink a lot of water, or they eat only canned food? Unfortunately, that's not always the case. In today's video, I'm tackling some of the most common myths around kidney disease in cats. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. Kidney disease is one of the most common health issues in cats, particularly as they age. It can happen in a quick manner in something called acute kidney failure, where the kidneys just fail immediately, or it can happen slowly over time in something called chronic kidney disease, and this is definitely more common in our senior cats. Essentially, the kidneys, whether it's acute or chronic disease, are no longer able to act as filters. Their job is to filter toxins out of the bloodstream, and when they don't work, the bloodstream doesn't get filtered. In either case, acute or chronic, catching it early can make a world of difference. Myth number 1, kidney disease only affects older cats. While it's true that chronic kidney disease is more common in our older cats, it can happen in young cats, middle-aged cats, or old cats. In fact, chronic kidney disease itself is suspected to be caused by small insults to the kidneys over a period of time. So it makes sense that our senior cats are more affected with it. But the younger cats can definitely be affected by toxins, infection, inflammation, any of those other things. Urinary obstructions are far more common in our young cats, particularly our overweight male cats, and that's definitely an acute insult to the kidney. Things like severe dehydration can also be an acute injury. No matter what your cat's age, routine physical exams and wellness testing are ideal. We want to trend the blood work, we want to trend the urinary tract health, and we also want to trend blood pressure. If we can get repeated values on those and trend them over time, we're more likely to catch problems early when we've got a really good chance at doing something about them. Myth number 2. Cats with kidney disease look sick. Now, it would make sense for a cat with kidney disease to look sick, particularly knowing what the kidneys do, but that's not always the case. Just with everything else in life, cats make up their own rules. And cats in late stage kidney disease or acute kidney failure definitely tend to look sick. But if we can catch this earlier in what's called stage 1 or stage 2 chronic kidney disease, they don't always look sick. A lot of times their coat quality is still good, they're eating, maybe their weight is still normal. Things are just a tad bit off, and unless you're paying really close attention to it or trending those values, as I had just mentioned, you're not going to notice it. Some of the subtle early signs that you may see are an increase in thirst, increase in urination, or even mild weight loss. And oftentimes those can be so subtle, because cats are masters of disguise, that they can go unnoticed. More of the middle ground with these cats is kind of that chronic weight loss, or sometimes the only report we get is that they vomit all of the time. And since there's this common misconception that cats are vomiters, kidney disease can go unnoticed. While there are a lot of causes of vomiting in cats, vomiting is not normal in cats. Hairballs to some degree can be normal in our long-haired cats just by function of that long fur, but vomiting should never be considered normal, particularly if it happens all the time or on a recurrent basis. Us too, we don't always feel great, and we may have a random episode of vomiting, so that can happen with our cats. But recurrent vomiting is a health issue, and it can pose a dehydration issue, which we know can cause this acute insult to the kidneys, which in the long term can cause chronic kidney disease. So even though your cat may not look sick, it is important to keep an eye on their litter box habits, their urination habits, their drinking habits, all of these little tiny things that just happen on the day-to-day, so that if there is that slight change, you can get your veterinarian involved. Myth number 3. Cats can't be treated for kidney disease. This one's kind of complex, but also flat out wrong. There is a procedure available to do kidney transplants in cats. Now, while it tends to be too expensive for many people, it involves another cat and lengthy hospitalizations, making it unrealistic. There is actually a treatment. Being that it's not a practical treatment for most, we often turn to management instead of treating kidney disease. Now, backing up a little bit, if your cat has acute kidney failure, meaning they have a urinary obstruction, or they got into something toxic, or there's a severe infection or inflammation going on, if we can find the underlying cause and treat it, sometimes we can protect and save the kidneys. But in these cases of more chronic kidney disease, we can't actually treat it without a transplant. And again, since that's not usually practical for most people, we focus on management strategies. These management strategies will include nutrition, supplements, medications, and oftentimes some form of fluid therapy, whether it's encouraging our cat to drink more, IV fluid therapy in a hospital situation, or subcutaneous fluid therapy where the fluids are actually given under the skin over a period of time. Regardless, many cats can be managed with kidney disease rather than treated. And it's uncommon with chronic kidney disease that we don't have some sort of management strategies we can use to make our cats feel better and do better over the long haul. Myth number 4, dry food causes kidney disease. Now, opinions aside on what we think our cats should be eating, this particular myth is not only significantly damaging, it's very, very frustrating. We know hydration is important for overall health in cats, and our focus should definitely be on keeping our cats hydrated, but there has never been, to this point, any scientific evidence that dry food is actively causing kidney disease. This myth produces a lot of guilt in cat caretakers whose cats either won't eat anything but dry food, or they can't necessarily afford the extreme expense that can come with feeding canned food or a whole food diet or a homemade diet. It's simply not beneficial to perpetuate this myth, and it tends to cause way more stress than it needs to. As I had mentioned earlier, the current theory for chronic kidney disease is that these are multiple small hits to the kidney over time, meaning those multiple insults attack parts of the kidney and decrease their function over time. And things that we know will cause these multiple hits are dehydration, not because they're eating dry food, but for other reasons, inflammation, infection, and toxins, in addition to other things. If it were truly as simple as one specific thing was causing kidney disease in cats, I absolutely promise we would have cured this by now. No one enjoys dealing with kidney disease. It is important to pay attention to your cat's hydration status though. And this may involve getting your veterinarian involved to ask them, is my cat hydrated? What does my hydrated cat look like? What do I need to do to keep my cat hydrated? Studies have shown that chronic dehydration or multiple dehydration hits over time will absolutely affect the function of the kidney. On the flip side though, overhydrating is no good for the kidney either. We need to keep our cats functioning as normally as possible if we want to try and protect the kidneys on this hydration front. Meaning if your cat is sick and has a vomiting episode, we should probably be more aggressive about keeping them hydrated. Or if there's a change in your household and your cat spends more time hiding, we should probably keep it in our mind that if our cat's hiding, they're not drinking what they normally would. Or worse yet, do you have another animal in the house that is bullying your cat? Cats are masters of that side eye and preventing other animals in the house from doing what they don't want them to do. So if you have one cat that's guarding the water bowl, is your other cat drinking adequately to keep them hydrated? It's far more important to focus on these little things and keeping your cat hydrated and protecting their kidneys in that aspect than it is to worry about, is the specific food you're feeding causing kidney failure? And then if you are watching your cat closely and you're realizing, you know what, they might be dehydrated, taking aggressive action quickly to protect those kidneys. Now that I've gone over 4 of the most common myths and debunked them, let's turn our focus, in a bonus in this video, on prevention of kidney disease. As I mentioned, we don't have a specific cause in a lot of these cases, but we do know some management strategies that can help protect those kidneys and potentially avoid kidney disease in the future. One is regular veterinary checkups, at least every year, if not every 6 months, depending on the age of your cat and the recommendation of your veterinarian. These veterinary visits, while your cat is healthy, may seem like something that doesn't need to be done, but when we're dealing with a species that is so good at hiding their diseases, that external eye and exam and lab testing can make all the difference in the world. 2 is routine dental care. Dental disease is an infection. We know infections cause kidney disease. So if you provide routine and aggressive as needed dental care for your cat, they're less likely to have kidney disease. Provide clean, fresh water every day. Not just once a week, not just when you remember to fill the bowl, every day. Cats can be particularly finicky when it comes to their water sources. So we want to make sure they have fresh, clean water. If you have a cat who likes a fountain, use a fountain. If you have a cat who prefers to drink out of a mug, use a mug. If you have a cat that prefers to drink out of the dripping faucet, use whatever is necessary to keep your cat drinking that clean, fresh water on a daily basis. Feed a balanced diet appropriate for your cat's age and health. And oftentimes you'll want to get your veterinarian involved in this decision as well, but it is incredibly important that this diet is balanced. There are so many recipes on the internet and even some foods that aren't nutritious, they aren't balanced, and they are not in your cat's best interest. There are some mineral and electrolyte imbalances and deficiencies. The kidneys have to work extra hard to account for these, and we don't want to put that extra stress on the kidneys. Remove toxins from the home. Plants like lilies, chemicals like antifreeze, and even some human medications are toxic to cats, particularly to the kidneys. We want to remove these from the home environment entirely and don't even put our cats at risk. And then my sixth bonus tip for prevention is know your cat's habits inside and out. Know when and how much they eat. Know when and how much they drink. Monitor their litter box habits carefully. The size of those urine clumps can tell you a lot. And if you don't have a cat that you routinely see drinking and suddenly you see them drinking, that's a red flag. Know these habits inside and out so that when there is a change to them, you can alert your veterinarian and we can jump on that lab testing to check and see where our kidney health is at. I know kidney disease sounds scary, and it certainly can be, don't get me wrong. But with the right knowledge, you can make informed decisions and do what is best for your cat. Don't let common myths stop you from doing what is best for your cat and providing the best care. If you found this video helpful, hit the like button, subscribe for more tips going forward, and share with your fellow cat lovers. Until next time, take care of your kitties.